there's a twofold approach that we've taken, and the first is what we've created through the Shoulder Center, which is sort of a hub for shoulder excellence. It's not all about shoulder surgeons. We have physiatrists, we have sports medicine physicians working with us, and we have a physician assistant that we've trained to become a shoulder expert that is physically present in the same location as the 3 surgeons who have co-located and started the program. And then on the other hand, we wanted to make sure that people could access that same level of care, or at least the beginning of that care, in their community by education of family physicians and having someone that we call a shoulder champion in their own community.
So, because that's it, right? Like the poor GP is you're sent, you have to get the people to the right place, but you're expected to have this depth of knowledge in each of these fields, which is really sort of it's unrealistic to have, extensive knowledge in all of them. So in some ways it's sort of triage getting them. So in each local area then, so each major city then would have a shoulder expert that would then be able to refer, so of the GPs?
I think the initial plan was for us to roll out to family physician groups or family physician teams where they would identify one person to be their expert within the team. So you wouldn't even necessarily need to be in a major city to have this happen. You just have to have an interested group of providers and one person within that group who would identify themselves as being the point person. And that person would essentially be able to provide good advice based on the shoulder center model. And it would be aligned with the advice that they would be given along the way so that there is no misunderstanding from provider A to provider B. And if the problem got too complex or the patient had reached the end of what their primary care physician or nurse practitioner could offer them, that we could provide care further along in that continuity.